Well, what a pleasure to be back with the real truth about health. It's really quite an outstanding achievement what you people have put together, and it's my delight to join with you again this year. I thought we'd focus on treating the cause to prevent and reverse heart disease, which is really, I think, gets really at the foundation of really how we ought to treat this disease, which is the number one killer of women and men in Western civilization. Now, I wrote an editorial for the American Journal of Cardiology in September of 2010, and the title of it is the therapy of coronary artery disease, the radical mastectomy of the 21st century. Now, what in the world did I mean by that? Well, you have to recall that the radical mastectomy was devised by William Halsted, who was a towering figure of a surgeon at Johns Hopkins Hospital. And this was in 1882. And that operation removed all the breast, all the skin over the breast, all the muscles under the breast on that chest wall, and a radical lymph node dissection. The operation was radical. It was disfiguring. It was painful. And many women preferred to keep their lump in their breast rather than have this operation. Now, how does that relate to cardiovascular disease? Well, 40 years ago or more, we had the bypass surgery and we had stents. When at that time, heart disease was the leading killer of women and men in Western civilization. Now, 40 years later, with those innovations, the number one killer of women and men in Western civilization remains cardiovascular disease. And really, it's really quite remarkable what happened to the radical mastectomy, which was for 100 years, it was a standardized surgical error until in the 1970s, courageous young physicians began challenging the radical mastectomy. And I think the same thing is going to happen if we're going to move ahead in cardiology. We've got to challenge just because, with all due respect, with the pills that we use for heart disease, with the stents, and with the bypass, none of those items have one single solitary thing to do with the causation of the illness. And when we look in hindsight, we've known for 100 years that there are multiple cultures in the planet Earth where cardiovascular disease is virtually non-existent. If you were to take your shingle as a cardiac surgeon and hang it out in rural China, the Papua Highlands, Central Africa, the Tarahumara Indians in northern Mexico, forget it. You better plan on selling pencils. These people don't have cardiovascular disease because why? They thrive on whole food, plant-based nutrition. And the question that I've had for several decades is, why haven't we brought that information to Western civilization? Why haven't we brought it to the United States of America? All right. Now, this is the oldest slide in my presentation. I took this in 1968. In 1968, I was leaving Vietnam, having spent a year there as a combat surgeon. And the reason I have this slide is to remind me to share with the audience that when we autopsy our young GIs who die of combat in Korea, it was interesting that of those average 20-year-olds, that 80% of them already had gross evidence of coronary artery disease that you could see without a microscope. Not enough for their cardiac events, but here you can see already at that young age, they had early disease. So that study was, interestingly enough, repeated 45 years later in 1999, this time looking at young women and men who have died of accidents, homicides, and suicides between the ages of 17 and 34. And now early coronary artery disease is ubiquitous. Again, not enough yet to cause their cardiac events, but here at this young age, it is established. So it's really not a great surprise that if those individuals are eating the same diet into their 40s and 50s, we now begin to see this absolute tsunami of cardiovascular disease. Now, it was about, let's see, it was about 17 years ago or more that I was moderating a panel in the West Coast. And Lou Culler, who is a chairman of public health at the University of Pittsburgh, was on the panel. And on the panel that day, he made this following statement. All males 65 years and over, and all females 70 years and over, who have been exposed to the traditional Western diet have cardiovascular disease and should be treated as such. So if there are any of you in this audience today who are over the age of 17, rest assured that if you have been eating the typical Western diet, you have been forming the foundation of cardiovascular disease. Now, this is kind of fascinating from a historical standpoint. In World War II, it was characteristic that when the Germans really overran the Low Countries of Holland and Belgium, and they occupied Denmark and Norway, it was characteristic that the Germans would take away for their troops the livestock. So for these Western European nations, their cattle, their sheep, their goats, their pigs, their chickens, their turkeys were gone. And suddenly, these Western European nations now became plant-based. And it was Doctors Strom and Janssen, writing in England's leading medical journal, The Lancet, in 1951, they looked at the deaths from heart attack and stroke in Norway during this time period. So let's do this. Let's start together on the left-hand side of this slide. And in 1927, you can see deaths from heart attack and stroke going up. 1930, going up. 1935, going up. 1939, whoop, in come the Germans. Down goes the death rates. 1941, down go the death rates. 1940. But look what happened in 1945. There was the death of Adolf Hitler, the cessation of hostilities in the European theater, and immediately back comes the meat, back comes the dairy, back come the strokes, and back come the heart attacks. Really a profound change, but we just didn't get it. Now we're going to look at some arteries. On the right, you're going to see an artery that is obviously thoroughly diseased. And you're probably saying to yourself, when that small remaining opening closes off, there'll be a heart attack. Well, actually, interestingly enough, only about 10% of heart attacks will occur from something which is this disease. Yes, indeed, it may cause chest pain and shortness of breath. But what happens is usually something like this has taken so long to become this disease that as it is narrowing and narrowing and narrowing, the downstream heart muscle from this blockage has recognized that it has not been getting its due supply, and the body does the best it can to make its own bypass. And characteristically, when you do an angiogram of this, you will often see these tiny little collaterals coursing around this blockage, which are enough to protect the downstream heart muscle from having a heart attack, even when that small opening closes because of this backup supply. Obviously, the backup supply never equals what it would be normally. But I mention that so that you'll understand, as we see later, we're going to learn about how 90% of heart attacks are caused. But while we're here, though, let's look at the left. And that's the normal artery. And I want all of you, even those in the back of the room, to know that that tiny little dark line lining the inside of the artery is called the endothelium. We're going to have a lot more to say about that. Now, the first thing that happens when you are eating that milkshake, that cheeseburger, that pizza, those cellular elements in your bloodstream begin to get sticky. Your endothelium becomes sticky. Your platelets, your clotting factors get sticky. Your LDL cholesterol gets sticky. And now, this happens to be a slide from Peter Libby from Harvard that I'm borrowing. And even though I went to Yale, you'll know that we often share information that Harvard has to give us. Now, to make sense of this, the blue area is where the blood is flowing. At the bottom of the blue area is the beginning of the artery wall. And you can see that single layer of cells lining the inner layer are the endothelial cells. Now, to make sense out of this, let's together once again, let's go to the left upper corner, and you will see there these orange molecules of your LDL cholesterol, which has been oxidized by the free radicals that come from this food that we've been eating. And those LDL particles in the upper left eventually bump up against the sticky endothelium and find a crack, a fissure, an opening where they can slip through. And now we have the oxidized LDL particle in the subendothelial space. And at this point, Peter Libby no longer paints the LDL orange. He paints it yellow because he wants you to know that it is a small, hard, dense, oxidized LDL particle, which the subendothelial space does not like, and calls upon our SWAT team, which here Peter Libby of Harvard has painted blue in honor of Yale, and we like that. Now, once this SWAT team is also in the subendothelial space, it begins its job of gobbling up all these small, hard, dense LDL particles as it transverses from left to right in this slide. Now, when we get all the way over to the right, where the SWAT team is now absolutely chock full of all these small, hard, dense LDL particles, we do in medicine what we do so often, we change the name, and it now becomes a foam cell. And the foam cell truly is the Darth Vader of this sequence of events. Why? Because the foam cell elaborates these nasty metalloproteinases like stromatolin, collagenase, myeloperoxidase. What do they do? The metalloproteinases progressively will thin out the cap over the plaque. Let's direct our attention to the figure on the left here. And you will see, if you look carefully at the cap over the plaque, in the upper portion of the plaque, there is a tear. And now what happens is there is the extravasation of, or the oozing out of, if you will, of plaque content into the flowing blood. That tends to activate our clotting factors, platelets. And if we go now to the middle figure, B, you can see a clot beginning to form where there was that tear in the cap over the plaque. And that clot is in and of itself self-propagating. And so in a matter of minutes, now we go all the way from just that little tear in the cap over the plaque. Now we're in the figure on the far right, figure C, and there is so much clot, the entire artery is blocked. And all that downstream heart muscle below there is deprived of oxygen and nutrients. And this is now 90% of your heart attacks. Now, if I do my job correctly today, hopefully all of you and all of your friends and relatives will be able to make themselves heart attack proof. How are we going to do that? Well, we're not going to do that with a pill. We're not going to do that with a stent. We're not going to do that with a bypass. We're going to do it by changing your biochemistry. How are we going to change your biochemistry? We're going to do that by changing the food that you eat, your diet. You're going to be plant-based. And when you're plant-based and you change your biochemistry, that entire cascade of events that I've just shared with you is not going to happen. You're not going to oxidize your LDL cholesterol. It is not going to migrate into the subendothelial space. There will be no call for the SWAT team or the foam cell. And with no foam cell and no metalloproteinases, there will be no thinning of the cap over your plaque. As a matter of fact, you will strengthen the cap over your plaque. And when you strengthen the cap over your plaque, it cannot rupture. If you cannot rupture the cap over your plaque, you now have made yourself heart attack proof. We think that takes at least about 3 weeks. Now, you don't have to pay attention to the X-ray on this slide, but let's sort of focus on how the artist has drawn the opening to this artery. Half of it is filled with a blockage or plaque, and the other half is still open. And the other half, which is open, if you look at the innermost portion of it, you will see the endothelial cells. Now, historically, it's rather interesting that we used to think up and actually until about 1980, we used to think of the endothelial cells as those cute little red bricks that were lining our pipes. However, that all changed in 1980 when Dr. Furchtgott, working in his laboratory in Brooklyn, was taking the largest blood vessel in the rodent, the aorta. And he would take this aorta and he would make sort of an elliptical spiral staircase cut on the aorta. And then he would immerse it in saline and it would constrict. But one day he decided there will be no cut, no injury to the endothelial cells. He immersed the aorta with no cut and it dilated. He did it with another one, the same way. It dilated. And now suddenly the race was on globally. What was the EDRF that Dr. Furchtgott had discovered? Endothelial derived relaxation factor. Thank heavens. That term was with us only 8 years. For at the end of 8 years, Dr. Furchtgott, Dr. Luignaro, and Dr. Murad discovered that the EDRF was a gas called nitric oxide. And because of that discovery, 10 years later, in 1998, those three men received the Nobel Prize. Now, what is it about nitric oxide that makes it worthy of a Nobel Prize? Well, let's look at its functions. One, nitric oxide will keep all the cellular elements within your bloodstream flowing smoothly like Teflon rather than Velcro. It keeps things from getting sticky. Number two, nitric oxide is the strongest blood vessel dilator in the body. When you climb stairs, the arteries to your heart, the arteries to your legs, they widen, they dilate. That's nitric oxide. Number three, nitric oxide will protect the wall of the artery from becoming thickened, stiff, or inflamed, protect us from getting high blood pressure, hypertension. Number four is the absolute key. A safe and normal amount of nitric oxide will protect us all from ever developing any blockages or plaques. So literally, everybody on the planet Earth, whether they're from London, Berlin, Chicago, New York, or Long Island, if they have cardiovascular disease, it is because by now, in the previous decades, they have so sufficiently trashed, injured, compromised, and turned their endothelial system into an absolute train wreck that they no longer have enough nitric oxide to protect themselves from making blockages and plaque. However, the good news is this is not a malignancy. It is a completely benign food-borne illness. And once you can get patients to understand that never, never, never again are they to pass through their lips and a single morsel of food that is going to further injure an already train-wrecked endothelium, because then the recovering endothelium can make enough nitric oxide to halt any disease progression, and we will often see significant elements of disease reversal. Now, I can just know that having done this presentation a number of times, about now, the audience is saying to itself, gosh, I kind of wonder, I wonder what my nitric oxide is. Well, we don't have a good test yet available in the office for this, but I will share with you how it's done from a research standpoint. If you take an ultrasound probe and place it over your brachial artery at the elbow, you will get a readout of the diameter of that brachial artery. And then you will put a blood pressure cuff around your upper arm and inflate it above systolic blood pressure so that for 5 minutes, you have absolutely zero blood flow to your forearm and hand. And I've done that, and it's not exactly habit forming. But then after 5 minutes, you release the blood pressure cuff and immediately remeasure the new diameter, the new diameter of the brachial artery. And in the normal individual, it'll be 30% greater. Now, the next great thing that happened was Dr. Robert Vogel, chairman of medicine at University of Maryland, took a group of healthy young subjects to a certain fast food restaurant that is characterized by arches, which are golden. Half of the group ate the cornflakes. The other half had the hash browns and sausage. For the group that ate the cornflakes, when they measured their nitric oxide level afterwards, it was normal. The group that ate the hash browns and sausage, 120 minutes later, with the brachial artery tourniquet test, they could not dilate the artery. That single meal of hash browns and sausage had so trashed, so injured, so compromised their endothelial cells, they were unable to make enough nitric oxide to dilate the artery. However, being young, later, as they followed them into the late afternoon, early evening, they kind of began to recover. However, you and I know that the next morning for breakfast is probably going to be scrambled eggs and bacon. Lunchtime, it'll be white bread with mayonnaise and cold cuts. For supper time, a baked potato with sour cream, lamb chops, vegetables soaked in butter, ranch dressing on the salad, and ice cream for dessert. Here in the good old USA, starting as our childhood, all day long, we begin injuring and injuring and injuring our endothelial cells. So it's no great surprise that as we approach midlife, we see this tsunami of cardiovascular disease. Now, this is something you can see on the ordinate on the left. We're measuring flow-mediated dilatation. In other words, the ability of the artery to dilate in relationship to certain diets. And you can see on the right, the worst for this would be the Atkins diet. The next worst would be the South Beach. And then the champ, the best of all, is plant-based nutrition. Now, the new kid on the block is the endothelial progenitor cell. And here we go. Sorry, didn't mean to get you sort of, there we go. The endothelial progenitor cell arises from our bone marrow and replaces our senescent, injured, worn out endothelial cells. Now, you probably want to know, how can you stimulate the production of your endothelial progenitor cells. Well, there was a study that was done in Japan, in Okinawa, and it consisted of following the healthiest human being on the planet, which is an Okinawan woman between the ages of 17 and 34. The group was divided in half. Half were the control group, and the other half were consuming 5 times a day a green leafy Okinawan vegetable. And when they finished the study and they measured the blood level of endothelial progenitor cells, they were strikingly higher in those women who were eating the green leafy Okinawan vegetables 5 times daily. Here is the actual peer-reviewed study on that. The dietary intervention with Okinawan vegetables increased circulating endothelial progenitor cells in healthy young women. And I think you'll see as we get later in this presentation into the actual treatment of disease, you will see how we apply that. Now, there's been a lot of discussion about HDL, and for the longest time, we used to think that having a high HDL was important. Well, that all began to change a little bit when I started our first study in 1985, and it was mostly men. It was just simply the way that the patients were sent to me. We had no preconceived idea that it should be weighted so heavily in men. We did our subsequent study where we had plenty of women were involved. But in this first study with men, remember the accepted lower limit of HDL cholesterol in men is 40 milligrams per deciliter. Well, lo and behold, as soon as these men started our program, we saw their HDL cholesterol begin to drop. And it went below their accepted lower limit of 40, and they were down in their mid-30s. But I just knew that this was the right diet for them. This was quite early on. Actually, Dean Ornish was noticing the same thing on the West Coast. But anyway, what we found was that with these men, they were at the same time that their HDL cholesterol was lowering, they were losing weight. Their symptoms of heart disease were markedly improved. And then when we carefully measured them, they were reversing their disease together with this lower than normal level of HDL cholesterol. Now, the other thing that happened about this point was that Pfizer was going to invent the drug that was going to be the end of heart disease. And it was called torcetrapib. It was in a pill where half of the pill was torcetrapib. The other path was Pfizer's other drug for lowering LDL, which was called Lipitor. And it was interesting that about the time that Pfizer was going to spring this on the public, the chairman of Pfizer got a phone call from the chairman of the Independent Monitoring Committee. And he said, Mr. Pfizer, Chairman, sir, we have a problem. Okay, what's that? Well, in the control group, there have been 51 deaths. However, in the torcetrapib group, there were 81 deaths. It was killing people. So fortunately, that never was exposed to the public. Now, the next interesting thing that happened was Dan Rader and his team of lipid chemists from the University of Pennsylvania, reporting in a New England Journal of Medicine in the January 13th issue of 2011, they had drawn blood from 2,000 patients and measured their HDL cholesterol. Some were high, some were medium, and some were low. Then they did an interesting follow-up. They measured the capacity of each of those HDL cholesterols to do its job of reverse cholesterol transport. And they found that not infrequently, you could have a very high HDL and it was really almost worthless in terms of its anti-inflammatory function. And yet you'd have some that were really quite modest or low, and it would be an absolute metabolic powerhouse. Now, therefore, it was up to a group from UCLA in that same year of 2011 in February, reporting in the journal, let's see, it was in National Medical Review. And what they had found, they were particularly studying that portion of the HDL molecule we call ApoA1. And ApoA1 is the protein moiety, the protein portion of that HDL molecule. What they found was that when persons would eat the typical Western diet, they would injure that ApoA1 moiety, and that would convert your HDL cholesterol from being a powerful anti-inflammatory molecule. That now made it a pro-inflammatory molecule, so that your HDL was now joining with your LDL to injure you. Pretty profound, pretty important, and it's important that I share this with all of the patients that come to the seminar that I conduct, because when they go back home to their doctor and they see that they're eating plant-based, which is so protective and produces so much anti-inflammation in the body, that your liver recognizes that the body is losing its inflammation, and it will produce lower levels of HDL. And people who are not aware of the increased health from having that lower HDL will unnecessarily frighten or alarm the patient. Now, we're focusing on nitric oxide, and let's just take a moment on this slide and look at what's on the left. If you look carefully, you will see that arginine is sitting on an arrow, and that arrow is pointed up to nitric oxide synthase, which is the enzyme contained within the endothelial cell and responsible for making nitric oxide. But arginine is supposed to be a precursor, so when the arginine goes and is converted by nitric oxide to nitric oxide, everything seems fine. Now, some of you at this point may be saying something like, maybe Dr. Esselstyn doesn't get it. I'm going to go down to the health food store and I'm going to buy a jug of arginine, and boy, I'm going to have nitric oxide coming out of my ears. Please do not do that. Obviously, that was sort of obvious, and it was tried in 2006 when a group of men who had had a recent myocardial infarction, a heart attack, were divided into two groups. One was the control group. The other group was having supplemental arginine, and in 6 months, the study was prematurely stopped. There were no heart attacks in the control group, but in the group taking supplemental arginine, there were 6 new heart attacks. Now let's go to the right-hand side, and you will see ADMA over an arrow, on top of an arrow. That's asymmetric dimethyl arginine, which is a normal metabolic product of protein metabolism. And that arrow also goes up to nitric oxide synthase, but instead of improving it, the ADMA will injure the nitric oxide synthase, decreasing the production of nitric oxide. Now, while ADMA is one way of getting rid of, one way of getting rid of the ADMA is through the urine, and the other way, it can be metabolized away through DDAH, dimethylarginine dimethylaminohydrolase. So the body has 2 reserves way to get rid of ADMA. Now, but it is so deleterious that if you look at patients, for instance, who are on renal dialysis, they cannot make any urine, they cannot get rid of their ADMA. And although they have this severe kidney disease, their highest mortality often is from stroke and heart attack because they do not have the production of nitric oxide because the nitric oxide synthase has been injured by ADMA. But what about the rest of us who have normal urinary output? Is there anything that we do that injures our ability to deal with ADMA? Yes. The Western diet will injure DDAH. High cholesterol injures DDH. High homocysteine will injure ADH. Insulin resistance will injure it. And so will diabetes, and so will smoking. And every single one of those is, except smoking, is going to be improved when you're eating whole food, plant-based nutrition. Now, this lists a number of wonderful protective molecules that we have in our body. And although there are 4 listed because of time constraints, we're just talking today about the endothelial cell. But I want you to rest assured that the endothelial progenitor cell, the HDL cholesterol, and dimethylarginine, dimethylaminohydrolase, all of those, everything on this slide is optimized when you're eating whole food, plant-based nutrition. Now, statins have come along, and they were supposed to be the miracle drug, but since they were brought on board in 1986, it is now really quite a few years since then, and heart disease is still the #1 killer. So while there obviously is some benefit from taking a statin, if you do have heart disease, for primary prevention, it seems to be rather modest. Now, there are a number of side effects here about the downside of the interventions. And I happen to do a little homework that I want to share with you now so you can understand that stents and bypasses do have a price to pay. Let's say, for example, if you have a nation that has 1,200,000 stents per year, 1% are going to die. That's 12,000 people. Another 4% while getting their stent will have a heart attack, and that's 48,000. Now, on the other hand, if we look at bypass surgery alone, we don't do as many. So let's say 500,000. The mortality with that is 3%. So that's 15,000 who will die getting bypass surgery. The same number who do the bypass will get a stroke, 15,000 strokes. Now, if we happen to add up the mortality from stents and the mortality yearly from bypass, that's 15,000 plus 12,000, which is 27,000 people will die getting these procedures. And if you take it over a decade, it is 270,000 people will die getting these procedures. That's over 250,000. And we really have to ask ourselves, can we possibly do better? And what about the expense? Well, right now in Medicare, 46% of Medicare is the expense generated through cardiology. And so we really have to ask ourselves, is it possible that we can do better? This is a comment from Walter Willett of Harvard, who happens to be the director of their public health department, who says, the current path leads to increasing adiposity, diabetes mellitus, cardiovascular disease and disability, and an unfit, socially isolated population stuffed with pills and subjected to frequent palliative procedures. All right. Well, now let's go to where the rubber really meets the road. This is the first study that I got involved in back in 1985, and I had gotten interested in this, and you're probably asking yourself, what in the world does a general surgeon have as an interest in nutrition? It was while I was chairman of our breast cancer task force back in the late 1970s, early 80s. I found myself becoming increasingly disillusioned with the fact that for no matter how many women I was doing breast surgery, I was doing absolutely nothing for the next unsuspecting victim. This led me to do a bit of global research, and it was quite striking to find that there were multiple cultures where breast cancer rates were 30 and 40 times less frequent than in the United States. And if you were to look at rural Japan in the 1950s, breast cancer was very infrequently identified. Yet as soon as the Japanese women would migrate to the United States, by the second and third generation, still pure Japanese American, they now had the same rate of breast cancer as their Caucasian counterpart. Perhaps even more powerful was looking at prostate cancer rates in Japan. In 1958, how many men in Japan had died of prostate cancer? 18. That was one of the most mind-boggling public health figure I think I've ever encountered. By 1978, 20 years later, they're up to 137, which still pales in comparison to the 28,000 who will die this year from prostate cancer in this country. Well, it was along about this time in my review that it was apparent that I was seeing multiple cultures where cardiovascular disease was virtually non-existent. And it just occurred to me that there would be more bang for the buck if we could get people to stop eating the foods that were giving them heart disease, because at the same time, it was quite likely that they would diminish the likelihood of the common Western cancers of breast, prostate, colon, and perhaps even pancreatic. So that was sort of the background in how I would sort of approach and do this study. You just can't, you you can't raise the flag and say, but stop eating the foods that are killing you. You really have to do some research. That's the only way it's going to make some progress. So I knew I was committed to doing this research, but since I had grown up on an Aberdeen Angus and a dairy farm, that really was going to be hard for me to get started, because although I knew I was going to do it, I was a cholesterolholic, as it were. My father had had his first heart attack at 43. And anyway, finally, you go through, when you're thinking about making a lifestyle transition, Dr. Prochaska from Rhode Island has shown us that you go through these several stages where you go from pre-contemplation to contemplation to action and to maintenance. And I was over here somewhere around contemplation when finally I was in New Haven, Connecticut with Ann, my wife, at a medical meeting, and God, the papers were really not that exciting, and the weather was awfully rainy. But nevertheless, they always have a banquet after these meetings, and at the banquet, this waitress put a plate in front of me, and the roast beef was so enormous it was draped over the sides, and I just was shaking my head. And Ann said, "You're not going to eat your roast beef?" I said, "No." And it was interesting. She said, "Well, then I'll have it." Well, Ann's mother had actually died of breast cancer at age 52. And 2 weeks after that meeting, her sister came down with breast cancer. And then she looked at me and said, "I'm with you." So we started our with the idea that the first thing we had to do, we had to eat ourselves this way for at least a year. And I think my cholesterol was 185 or 90 when I started. And after several months, it was 155. And I was still upset because I wanted to be better than a Tarahumara Indian. And so I knew I had to stop the oil. And as soon as I stopped the oil, my cholesterol suddenly was 119. I said, "I think we've got this now." So the study was started by actually my talking with Bill Sheldon, who was then the chairman of Department of Cardiology, and he allowed me to make a presentation before his department and asked for about 24 patients, which was about the maximum that I could manage, and at the same time carry out my surgical obligations. And my late brother-in-law used to call these patients Essie's walking dead. They had failed their first or second bypass. They had failed their first or second angioplasty. They were too sick for these procedures, or they had refused. 5 were told by their expert cardiologist they wouldn't live out the year. And I'm happy to say that most of them really made it close to 20 years. Now, the question that I had doing this research is, how would I be sure to get these patients to adhere to this significant nutritional change? And for that, I used the same mantra that I used for my cancer patients that I had learned years ago from a wonderful West Coast surgeon by the name of Bert Dunphy. And Bert used to say that patients with cancer are not afraid to suffer, and patients with cancer are not afraid to die. But patients with cancer are afraid of being abandoned by their family or by their physician. So for the first 5 years, I was seeing these patients every 2 weeks in the office when I would check their blood pressure, their cholesterol. I would go over every morsel they ate. At the end of 5 years, I became more courageous and I stretched it out to once a month. Most cardiologists see their patients twice a year. Then at the end of 10 years, they were pretty well on autopilot. So I was able to stretch out to see them quarterly. And then at the end of 12 years, it was time to write this up, because this was one of the longest, if not the longest, follow-up of patients seriously ill with heart disease with this type of nutrition. Now, as you see listed on this slide, there were 23 men and 1 woman who had severe triple vessel disease. And the whole idea was to have them avoid eating anything that was going to injure their endothelial cells. So not a drop of oil, olive oil, corn oil, soybean oil, safflower oil, sunflower oil, coconut oil, palm oil, oil in a cracker, oil in a piece of bread, oil in a salad dressing, oil in a chip, the whole idea, and also oil in a salad dressing. The idea was to eliminate oil, because oil injures endothelial cells, as does anything with a mother or a face, meat, fish, fowl, turkey, and eggs. And we wanted to avoid dairy, milk, cream, butter, cheese, ice cream, and yogurt. And avoid, it's not here, but it should be avoided, the sugar and caffeinated coffee. Now, here I want to share with you the work of Stan Hazen from our institution, looking at lecithin and carnitine, which are molecules that are found in these animal products that you see listed here that are consumed by omnivores. And what Stan found was that omnivores contain in their microbiome, in their gut, bacteria which are capable of metabolizing lecithin and carnitine into a molecule called TMA, trimethylamine, which is rapidly oxidized by your liver to trimethylamine oxide. And it is trimethylamine oxide that injures your endothelium and injures your blood vessels. So this was really rather exciting. It was rather powerful research, and it shows why it is that persons who are eating the paleo diet or keto diet and all that animal products really are putting themselves further at risk. And here is the schematic. Notice the lecithin and carnitine metabolized by gut bacteria producing TMA, which is oxidized in your liver to trimethylamine oxide, which is capable of contributing to vascular disease. However, what Stan Hazen also found out that was quite powerful was that when he took somebody who was absolutely totally committed to plant-based nutrition and fed them a lamb chop and then measured their blood, no TMAO. Why? Because persons who are totally plant-based do not possess in their gut, in their microbiome, the bacteria that are capable of converting lecithin carnitine into TMAO. Another marvelous bonus from being plant-based. So, continuing with this original group, what did they eat? They ate all these marvelous whole grains, 101 different types of legumes, lentils, and beans, all these marvelous red, yellow, and green leafy vegetables, and some fruit. Now, I should share with you that it was about a decade ago that I made a major modification in our program for patients, and I want to share that with you. The reason for making this modification was increasingly an awareness that the endothelial production of nitric oxide, which is so essential, was age dependent. You never heard of a boy or girl at age 8 having a heart attack. They have nitric oxide coming out of their ears. But by the time they're beautifully healthy at age 50, they have 50% of the nitric oxide they had when they were age 25. And by the time you're 80, you've lost 70%. So I made a modification in our program to have a greater stimulation of the endothelial production of nitric oxide, and at the same time took advantage of the newer research that was showing us that mankind had an alternate pathway for making additional nitric oxide. And here it goes. Therefore, when I have a patient with heart disease, I need them to chew, not smoothies or juicing. I need them to chew a green leafy vegetable roughly 6 times a day. After it has first been steamed 5.5 to 6 minutes, so it's nice and tender, and then they must anoint it with several drops of a delightful either rice or balsamic vinegar. Why? Because research has shown us that the acetic acid from those vinegars can restore the nitric oxide synthase enzyme contained within the endothelial cell that is responsible for making nitric oxide. So you're going to chew this alongside your breakfast cereal, again as a mid-morning snack, again with your lunch and sandwich. That's 3, mid-afternoon 4, dinner time 5, and of course I adore it when you have that evening snack of arugula or kale. Now, the second benefit that comes from chewing the green leafy vegetable, it restores the capacity of your bone marrow to once again make the endothelial progenitor cell. What do? Remember, we saw them earlier. They replace our senescent, injured, worn out endothelial cells. Now, the third benefit from chewing the green leafy vegetable, why you are chewing a green leafy vegetable, you are chewing a green nitrate. As you chew the green nitrate, it is going to mix with the facultative anaerobic bacteria that reside in the crypts and grooves of your tongue. Those bacteria are going to reduce the green nitrate you are chewing to a nitrite. When you swallow the nitrite, it is now your own gastric acid, which is going to further reduce the nitrite to more nitric oxide, which can enter your nitric oxide pool. So think about it. With absolutely minimal expense, no hideous side effects, all day long, you are absolutely, from dawn to dusk, morning to night, you are absolutely restoring nitric oxide, the very molecule, the deficiency of which gave you this disease in the first place. Now, there's a caveat to this. Toothpaste with fluoride, public drinking water with fluoride, and mouthwash will injure the beneficial bacteria in your mouth. And I do not like antacids because antacids will decrease your gastric acidity, and you will be unable to reduce the nitrite to more nitric oxide. Now, the top 6 are kale, Swiss chard, spinach, arugula, beet greens, and beets. And if you want to know the whole list, it would go bok choy, Swiss chard, kale, collards, collard green, beet greens, mustard green, turnip greens, snapper, cabbage, Brussels sprouts, broccoli, cauliflower, cilantro, parsley, spinach, and arugula and asparagus. And the reason I do that is because I want you to know how important whole food plant-based nutrition is for your memory. Okay. All right. Now, no oil. Here we go. The average cholesterol, when we started with that earlier, that first group was 237 milligrams per deciliter. And over the next 5 and 12 years, they were able to keep the total under 150. And the LDL was right around 80. And this is the levels at which they had wonderful things happen. Now, I do want to share with you at this point some angiograms of these patients, which happens to show disease reversal. And these angiograms were reviewed in triplicate by senior technicians in the Cleveland Clinic Angiography Core Laboratory, who do this all day long for national medical trials. So when I give you a percentage of improvement, I know that it's accurate. This happens to be a 67-year-old retired pediatrician, and you are looking at the left anterior descending artery, and from the arrow on the left to the arrow on the right, it was a 10% improvement, which is about as small as the naked eye can see. It's easier to see in this next one, in this 58-year-old factory worker, where you're looking at the circumflex artery to the back of the heart that was measured from the arrow on the left to the arrow on the right as a 20% improvement. Wait a minute, now we got to get something going here. There we go. Here we have a 54-year-old security guard. And this is the right coronary artery. And from the arrow on the left to the arrow on the right, this was described as a 30% improvement. Now, this young gentleman is Joe Crow. He's in the first chapter in my book. He is a surgical colleague and a friend. At age 44 in 1996, Joe began to get chest pain. He was not hypertensive. He was not diabetic. His cholesterol was 156. He was not a smoker. He had no family history. He exercised regularly. Chest pain. So he was worked up by cardiology in October of 1996. They could find nothing that was seriously wrong. And a month later, in the third week of November, he had finished his surgery and had sat down to write postoperative orders when suddenly he felt the elephant was now sitting on his chest. Pain in his left jaw, left shoulder, and arm. He was having a heart attack. They whipped him down to the catheterization laboratory. They start the catheterization, cardiac arrest, resuscitate, finish the catheterization, one more cardiac arrest, resuscitate, stabilized, finally set up to the floors, and then discharged 3 days later, but very depressed. Why was he depressed? He was depressed because at the time of his catheterization, the entire lower 1/3 of his left anterior descending artery, this widowmaker, was all moth-eaten and diseased, as you can see around this yellow bracket. And you just can't pound in stent after stent after stent. And it was too far down the artery for a bypass. So he was very depressed about this. And Ann and I had Joe and his wife out for dinner 2 weeks after his heart attack. Joe, come on. You've been eating this horrible Western diet, and you got the typical Western disease. We've got 10 years of data. Why don't you think about going plant-based? He said, okay, I'll give it a shot. They really couldn't offer me anything else, but I'm not going to take any of those statin drugs. I don't trust them. Fine, that's your call. He became the absolute personification of commitment to whole food plant-based nutrition over the next 2.5 years. And then he had another angiogram. Now, up in the surgical office areas, our doors are about 3 doors apart. And I found myself at noontime on the day that earlier that morning, Joe had had his follow-up angiogram. I walked over to his office, let myself in, and there he was sitting behind his desk. I said, Joe, I'm aware that you had your follow-up angiogram today. Mind sharing with me? How did it go? So he got up from his desk, came around, put his arms around me and said, I think we're doing okay. I said, well, would there be any chance that I can see the follow-up angiogram? And he said, sure. Now, that's pretty remarkable. And the body, when the plaque is young and the patient seems to be young, the body, and the plaque is made up of inflammation, fat, and cholesterol. The body can do an amazing job of actually getting rid of it. Now, on the other hand, when the plaque has been there for decades, and it's made of fibrosis and scar and calcification, it's unlikely that you're going to get much of it to go away. But on the same time, it's going to be my job before we wrap this up today to show you why it is that even those older patients where this plaque may not go away are going to get back to full activity of daily living without restriction. Now, again, this next one is another young person. This is a 45-year-old gentleman from there we go. 45-year-old gentleman from Florida who in July of 2017 had a heart attack. And as you can see where this arrow is on this particular artery, that was described as an 80% narrowing of this artery, which is a branch of the obtuse marginal, which goes to the back of the heart. Now, this patient had other blockages, which really had the cardiologist advising that the patient have bypass surgery. But the patient said, no, I've read this book, Prevent and Reverse Heart Disease, and I'm going to try to do it with diet. And the cardiologist, of course, said, well, this will not work. So it was a year later that he had followed the Prevent and Reverse book, and they had another angiogram. And lo and behold, it was no longer 80%, it was now 40% blocked. Well, at this point, the patient changed cardiologist, and his new cardiologist, a year and a half later, wanted another angiogram. And at this point, now it was completely gone. But the point that I think I've always been trying to make, because this data is absolutely so exciting and so provocative, and is so empowering to patients. This patient had absolutely no assistance from any physicians to make this decision. The cardiologists were against it. And I think that really the data is so overpowering. The epidemiological data of the multiple cultures that don't have this disease, and how we can often see striking examples of disease reversal, I think it's totally appropriate that every patient with this disease ought to be offered the option of getting rid of their disease. Now, on the other hand, let's go back to the study. There were, of those original 24 patients, there were 6 patients I knew within the first month. They were nice guys. but I had no money for this study. And they just didn't quite understand about plant-based nutrition. So with their blessing, I referred them back full-time to their expert cardiologists, and they became sort of my quasi control group. And over the next 12 years, two of them died, and then the others had the cardiac events that you see here of disease progression. On the other hand, of the 18 patients who stayed with us for the full 12 years, I wanted to know in the 8 years prior to coming into our study, while they were in the hands of expert cardiologists, they had 49 events of disease progression that you see listed here. However, once those 18 patients came into our study, over the next 12 years, 17 of them had no further events. We did have one little sheep who wandered from the flock at about 6 years, got into the French fries, lamb chops, glazed donuts, more angina, had to have a bypass, but now has come back with the flock and proves the point that I'm trying to share with you today. Now, as excited as I was in the results that we had with this original group of patients, we were highly criticized. Dr. Esselstyn, this is a very small study. Dr. Esselstyn is not compliant. It's not really randomized. And it's what makes you, and it's your diet is so strict. It's rather severe. And I always take objection to that because to me, the most severe diet available to the American population is the one that guarantees that roughly 98% of Americans are going to get ill from it. I think that's the radical diet. I don't see how you can call a diet that gets rid of disease anything but exciting and wonderful. But nevertheless, we were criticized and said, what makes you possibly think that you can repeat this study with a larger group of patients? And would you be able to get similar results? So we did. This was published in the American, this was published in the American Journal of Family Practice in 2014. This was 198 patients. And of those 198 patients, 89.3%, almost 90% were adherent in our follow-up of close to 4 years. There were 21 who were non-adherent. And it was rather interesting that when people say that patients won't follow this diet, why is it that we're able to get 90% to follow? I think if you're going to have a patient make this sort of significant lifestyle change, and it is significant, I won't for a moment say that it is not. It is severely significant in terms of a change. But if you're going to have a patient do this, you've got to show a patient respect. And the only way that I know to show a patient respect is to give them my time. So I will share with you that still once a month, I conduct a intensive counseling seminar. That's one day, it's 5.5 hours. Usually we limit it to about 18 to 20 patients. It's obviously during the pandemic now, it's all done virtually with Zoom. And patients are going to learn all about how they have created their disease and precisely how we are going to empower them as the locus of control to halt and reverse their disease. Now, that's not all that we do because, as I mentioned, it's so important to show the patient respect by giving them our time. Every one of those 18 or 20 patients, my secretary will give me a list of their name and phone numbers, usually 10 days beforehand. And I personally will call every one of them so that I can get my arms around their story. And at the same time, have them ask questions of me. So when they do come to the seminar, we have a strong platform from which we can all move forward. Now, this is kind of interesting because you can see here that there were of that group who were adherent, 27 had been told they had to have bypass or stents. And when they go through the program, they no longer have to have that. Now, how many recurrent events did we see during this time? In the group that we were adherent, there was one event. This was a patient who was actually on a vacation in China, and he totally forgot all the rules, was eating off the economy, and he had a tendency to have high blood pressure. And with all that salt, his blood pressure went through the roof, and he had a small cerebellar stroke from which he recovered. There's of course, the patients who were not adherent, 62% of those 21 patients had disease progression during that period of follow-up. Now, I wanted to show you a comparison that I made with our results for major cardiac events after roughly 4 years. I wanted to compare our results with some of the better known cardiology studies that are out there. And let's look first at the box on the far right, which is the Lyon Diet Heart Study. And at the end of 4 years, 25% had a major cardiac event, heart attack, stroke, or death. Now, if we go to the box to the left of that, there's the natural history of disease from Columbia Presbyterian Hospital in New York City. And at the end of 4 years, 20% major cardiac events, heart attack, stroke, and death. To the box to the left of that, Bill Bowden's Courage study, 19.4%. Now, to the left of that, there we are, 0.6%, one patient of the 177. And really, and you think about it, if I was really honest about the categorization, since he was not really compliant when he went to China, he should have been in the non-compliant group, but nobody would ever believe you if you said 100%. But why is it that our results are so different? It's over a 30-fold difference, and that is we were treating the causation of the illness. That's where the emphasis has been, to restore nitric oxide. And there's been a basic covenant of trust ever since the days of Hippocrates that whenever possible, the caregiver will share with the patient what is the causation of the illness. And sadly, today in cardiovascular medicine, that is very infrequently being done. Now, here we have all things. The same year, I wrote another paper, published in the Experimental and Clinical Cardiology Journal. The title of it was The Nutritional Reversal of Cardiovascular Disease Fact or Fiction. 3 case reports. Now, what possible business did I have writing up just 3 patients? Well, all 3 of them, I thought, were, as far as I was concerned, were grossly mishandled by present cardiovascular methods. This first patient, Bob Mercer, happens to be in Newfoundland, Canada. And at age 44, he had a small stroke because he had a complete blockage of his right carotid artery. And at the same time, he had such severe angina that they did find a wonderful surgeon in Toronto who would operate on him for bypass surgery, even though he had one completely blocked carotid artery to his brain. And the thing that was of interest is that was a wonderful result. And now he was about 69 years of age, but he was in trouble again. He had gained 40 pounds. He now was diabetic. He now had all of his angina all over again. He also had erectile dysfunction. And at the same time, he found that his one remaining carotid artery to his brain was now 90% blocked. Now, of all things to have happen at this point, his 37-year-old daughter had a heart attack. And during her convalescence, she found a book called Prevent and Reverse Heart Disease. And she said to her father, "Pop, we got to do this together." They did. And it was a year later that I got a letter from Bob Mercer who said, I wanted to thank you for writing Prevent and Reverse Heart Disease. I've lost 40 pounds. My diabetes has gone away. My chest pain, my angina has gone away. My erectile dysfunction has gone away. And my one remaining carotid artery, which was 90% blocked when I started your diet, is now 67% blocked. And here is Bob Mercer, before and after. This happens to be Jim McNamara. It was 11 years ago that Jim had an opportunity to start being plant-based. He had first had a small stroke, and they operated on his right carotid artery, and it was a total failure and never could get it opened up again. And then he began to get rather severe symptoms of claudication. And eventually they tried to do a sort of a angioplasty with stenting, and that was failed. So they tried bypass, and that one failed the first time. They tried it a second time, and it failed. And they was told you'd have to learn to get on with this limp and this pain and try these drugs. But his wife found out about our program. He came, and he's been wonderfully compliant. That was 11 years ago. He can walk nonstop. And he is so marvelously articulate about his experience that he's an integral part of our intensive counseling seminar, because Jim wraps up our session sharing his story, which is so powerful and so convincing to patients who wonder if this works. So in summary, there is no mortality from the diet. There is no morbidity from the diet. And the benefits improve with the passage of time. And there's no added expense because you got to eat. And most patients, once they've had a heart attack, sadly are walking around with literally the sword of Damocles hanging over their head, wondering, when is the other shoe going to fall? When do I get my next heart attack? Nonsense. You never have to have another heart attack. You can make yourselves heart attack proof. Now, switching gears, it's interesting that when 85-year-olds in Sweden and in the United States, by the time we're 85, 50% will have dementia. And it was Megan Leary and her team from the West Coast who were reporting at the stroke meetings in Miami in 2001, had looked up over 5,500 MRIs of the brains of Americans. And what they find, at age 50, you begin to see the appearance of these little white spots. These little white spots happen to be little strokes. And it's interesting, though. Here you are, age 50, big brain, tiny stroke, everything's okay. But bingo, before you know it, you're no longer 50. You're 60. 15 years have gone by, 15 more years of the good old American diet. And you find yourself saying more often than before, sweetheart, where'd I leave the car keys? Well, you kind of get over that. Before you know it, bingo, you're now 75, another 15 years. So you find yourself saying, sweetheart, where did I leave the car? Well, you get over that. Now you're 85. You look at your beloved and you say, are you my sweetheart? I can't reverse that. You don't suddenly wake up at age 85 and find yourself with dementia. You work hard in all those preceding decades to lay the foundation of this dementia. Here for your review is a normal MRI of the brain, no problem here. But look at this, I counted 90 of these little blocks in this. Can you imagine a message trying to go through that scar tissue? Now, on the other hand, here, let's see if we can get, on the left, you see the MRI of a 40-year-old triathlete. the benefit of exercise. The right upper, you see a rather atrophic thigh muscle in a 70-year-old couch potato, 74-year-old couch potato. And then the lower right, you have the thigh muscle of a 70-year-old triathlete. Pretty impressive. And now here we go back to 1986. And on the left, you are looking at the pulse volume at the ankle of a 54-year-old gentleman who had a fair amount of heart disease, and in addition, had a partially blocked artery in his thigh. And in walking across the skyway to my office, had to stop 5 times because of pain in his right calf muscle. But I was so focused on his heart, I forgot all about his leg until 10 months into the study. One day he said, "Dr. Esselstyn, do you recall when I first started seeing you, I was having to stop 5 times coming across the skyway because of pain in my calf?" He said, "You know, over the last month, it's gone away. It's absolutely disappeared. I don't stop anymore." So I said, "John, back you go to the vascular lab." And now you look at the pulse volume at his ankle on the right, it is double what it was. And this was absolutely a eureka moment for us. We now suddenly had, early in this experiment in 1986, 87, we had absolutely irrefutable, rock solid scientific data that food and food alone could absolutely reverse cardiovascular disease. And I know many of you are going to say, well, wait a minute, what about the statin drugs? Well, I presented to you 2 patients today, one Dr. Crow, who refused to take it, and Don here. And this was in 1986. We didn't have any statins at that time. Here's another. This is a 78-year-old, let's see, a 78-year-old retired high school chemistry teacher. And in his retirement, he and his wife loved to do the square nets. They would enter these square nets contests, but it was during the fast square dance, he would get bilateral calf pain. So we ended up seeing several vascular surgeons who got the image you see here, but he didn't like the magnitude of the operation that they were proposing. And he came to see us and said, "Dr. Esselstyn, if I choose your method, how long will it take for me to get rid of my calf pain?" So I looked at him with great wisdom in my face. And I said, "Probably about 10 or 11 months. 3 months later, I got a phone call. "Dr. Esselstyn, you do not speak the truth. The pain is gone." Now, it's hard for me to know without an audience where all of you might come from. But I should share with you that in Cleveland, Ohio, whenever we have a sporting event or a mystery on television, you can hear, before the advertisement comes on, you will hear the mellifluous tones of the announcers say something like, "When the moment is right, will you be ready?" Now, we all know that the artery to the penile artery is really quite small compared to the coronary artery. So not infrequently, before somebody comes down with heart disease, they may find that they're no longer able to raise the flag. However, all is not lost. Not infrequently, maybe 10 or 11 months after I've counseled somebody, I'll get a phone call. "Dr. Esselstyn, yes, this is Mr. So-and-so. All right, yes, good to hear your voice. Yeah, doc, I really thought I ought to give you a call because recently something has come up, and I'm wondering if I don't owe you another check." Now, I promised you that before we wrap this up, that I wanted to be sure that you understood that even the patients who are more senior, where a plaque may be filled with scar and fibrosis and calcification, can we get blood back into the rest of the heart muscle? So here is an example of a 58-year-old Youngstown, Ohio school bus driver. Now, the PET scan on the left, if it is orange or yellow, that indicates there is a good blood supply to the heart muscle. But you can see in this one on the left Where it is green, that is a poor heart muscle perfusion. That's the day that I counseled him. And his cholesterol went from 261 in 10 days down to, I guess, 126. Then 6 weeks later, we repeated his PET scan. It's all back. It's all improved. What's going on here? Here's another. This happened to be a 60-year-old downtown Cleveland stockbroker. And on the left, you can see the area that is perfused well with orange and yellow. But then there's this patch that is green, poor perfused. I counseled him then. The cholesterol went from 248 to 137 in 10 days. And then at 3 weeks, we brought him back for a repeat PET scan. Bingo, it's all back. How does that happen? What is going on? I really wanted to know. And so I actually had the opportunity to look at this interesting slide where all the heart muscle is gone. What you're looking at is the heart that is configured by its blood vessels. And you can see the three main arteries, the right coronary artery, the left anterior descending, and the circumflex. But those are the arteries, when they're riding on the surface of the heart, they get all the publicity about bypasses and stents. But where do they go? They all dive. They all dive into the heart muscle where they interdigitate and separate and joining others. And you can see there are literally thousands of these intramuscular arteries. It was about this time that I called to Rodriguez, who is the chairman of the cardiovascular pathology section at the Cleveland Clinic, who dissects 200 hearts a year from the deceased. And I asked him, Rod, how often do you ever see any blockages or plaque? Any blockages or plaque that are that have blockages? And he said, never. Well, now I think I had the answer. Because when I first see these patients, they've never had the cause of their disease treated. And their endothelial cells are so beaten down. They are hardly making any nitric oxide, which you recall is such a powerful blood vessel dilator. And at the same time, your endothelial cells are now your enemy. They're making two molecules of endothelin and thromboxane, which are vasoconstrictors. Again, that means that and as you look at this slide of the blood vessels in the heart, all of those thousands and thousands of vessels, when I first see these patients, are crimped. They're narrowed by the endothelin and thromboxane. And it's not, now it explains why it is that often within 4, 6, 8, or 10 days of these patients initiating therapy, where they're no longer injuring their endothelial cells, they're getting more nitric oxide, and they totally stop making the endothelin and thromboxane, so that this entire vascular tree is opening up, and which is why it's so exciting for them to realize that what they're doing is effective and is working. So let's summarize the 8 measures of disease reversal. Coronary angiograms will show reversal. You can see reversal on a stress test. I showed it with the PET scan. I've talked about the carotid ultrasound reversal and the pulse time of the thigh and the symptoms of reversal of angina, claudication, and erectile dysfunction. Pretty darn powerful and exciting when patients go to and completely commit themselves to reversing the causation of their disease. Now, the question arises is there really just heart disease is one illness, but what is it that happens to the rest of the patient's illness when you start treating heart disease? When you start eating whole food plant-based nutrition, our patients who have diabetes, it markedly diminishes, often goes away. Same thing happens with hypertension. Same thing happens to their risk of vascular dementia. Same thing happens with mentioned with their heart disease, with their Crohn's disease, with ulcerative colitis, rheumatoid arthritis, lupus, and multiple sclerosis, as well as allergies and asthma. It's almost as if the heavens have opened and presented medicine with one of the strongest items in our toolbox that we've ever had. Now, just to show you from a community standpoint how powerful this can be, on the upper left is that green line on the graph. This is indicative of why it was that the province of Northern Karelia in Finland in 1972 was the heart attack capital of the world. A lot of smoking. Everything was having clotted cream, heavy diet and meat and milk. And lo and behold, a really enterprising young physician from Helsinki, Pekka Puska, took it upon himself to go to Karelia and dealing with local authorities, community leaders, the patients themselves, tackling the dairy industry and the tobacco industry. Lo and behold, over the next 30 years, the province of Karelia decreased the rate of heart disease by 85%. And at the same time, the rest of Finland caught on a little bit later, but they were reducing their heart disease by 80%. Very provocative and exciting to think what kind of a really a community reversal of disease can happen. And at the same time, if you look at this, the figure, the second one up from the bottom, at the same time that they were reducing their heart disease, look what happened. Their cancer rate in Karelia was decreased by 67%. Very powerful and quite provocative. Now, this is a slide given to me by a physician friend, David Schumann, simply to show that when this gentleman who has diabetes was convinced to go on the plant-based diet, immediately his blood sugar levels began to plummet into a more acceptable range. And here's another one of his patients. This poor woman was really peeing away her bones because of her diet, because ordinarily your urinary calcium should be within the blue band. This poor woman was peeing away her bones, but Dave Schumann got her to change to plant-based nutrition. And within 1 week of starting the diet, she was now in the normal range. Pretty exciting. This happens to be a gentleman by the name of Joe Relino, who was a world famous strongman in the Coney Island area in 1920. And he and his mother, they lived in Brooklyn, were from the old school plant-based. And here he is actually at age 103. And I want to wrap this up. I always like to have you understand this is the A building at the Cleveland Clinic, where on the 8th floor, I worked as a surgeon for many years. But I like to show it to you so you can actually see what the trees look like, what the trees look like in Cleveland in February. However, when I retired from surgery, my interest in nutrition. I was hired to work at the Wellness Institute, and although the budget is really more modest at the Wellness Institute, the morale is quite high, and I always like to wrap up with this maiden, because while there's no question that if you've left medical school, brains are important. But nothing is as important as persistence, best exemplified by this young damsel in 1939 in Life magazine, trying to learn how to do the splits. And it's tough to do the splits, but she stuck with it and stuck with it and stuck with it. And sure enough, I believe it was Steve Shore who spotted her down near Bayshore in August of last year, and she got it right. All right. I'm going to say thank you for your understanding and your patience, and I'd like to try to tackle a few questions, if I may.
Thank you so much, Dr. Esselstyn. Just amazing as always. And we're just so thrilled that you're able to share all of that. Real quick, before we do have a few minutes for Q&A, before we jump in, where's the best place for folks to get your book or?
My secretary, Jackie Fry. Yeah, you can go to my website. Her contact information is there, dresselstyn.com.
Perfect. Okay, fantastic. Thank you for that. So yeah, we have a few minutes for some live Q&A. I see a few folks already have their hands raised. I want to make sure everybody here at our audience understands how we go about this here at The Real Truth About Health. We normally don't take questions directly from the chat box, but we do ask you to raise your hand virtually. And for those of you that don't know how to do that, all you need to do is look at the different tabs that you have in your Zoom window. And one of those tabs is called your Reactions tab. Click on your Reactions tab. A few emojis pop up, and one of them says raise hand. You click on that function. We will see your hands raised, as I see more and more coming in now. Thanks for that. I will then go ahead and call you by your first name, and I will unmute you, and you'll be able to ask your question of Dr. Esselstyn. So let's get started with Tracy. Tracy, welcome.
Wow, I thought this was a recording. Wow, I'm glad I'm stayed listening. Well, I had a question about TMAO, and I was wondering, I was about to give up eggs, and I was wondering about the TMAO, if it's just the yolk that I need to give up, or the whites, or both.
Well, I think if somebody is wanting to protect themselves from heart disease, I would give up both of them.
Excellent. Thank you for that, Dr. Esselstyn. And up next, we have Steve. Welcome, Steve.
Hi, Ben. Dr. Esselstyn, my hero. What an honor to be able to talk to you. My question is specifically regarding Dr. Brooke Goldner's Healing Smoothies.
Yep.
That they're made of 80% a pound, at least a pound of greens from your list, 20% sugar, 20% fruit, half a cup or more of flax or chia seeds, and there have been articles by Joel Kahn and on PubMed describing the enterosalivary nitrate, the alternate nitric oxide pathway. So, and both Robert Lustig was adamant that the disruption of fiber by the Vitamix lets loose the hounds of fructose. And you said something similar last night. I can't find any definitive studies on it, but Dr. Goldner's experience, my own personal experience, is not only with autoimmune, but heart disease, diabetes. Your influence is so profound that a day doesn't go by that this issue isn't brought up by somebody in our community, questioning the efficacy of the Goldner protocol because Dr. Esselstyn says no Vitamix. Dr. Clapper, who used to say you're not born clutching a Vitamix, added a caveat that doesn't count for Dr. Goldner's smoothies, and put up her contact information in her books. And my question is about our healing smoothies. We love Dr. Goldner, and she saves us like you save us every day.
Well, I think it's wonderful. I know Brooke Goldner. I think she's doing a great job, and I certainly think that her smoothies are absolutely working for her fine. I'm sure that there would probably be, we could probably have smoothies, but the reason I'm cautious about it with patients who have heart disease, as you heard me say perhaps last evening, that when you do the smoothie, if somebody wants it not to be so tart with just the greens, then they add an apple, an orange, or banana. And when you beat that up, now you've separated the fructose from the fiber, and it goes off like a rocket in your stomach, injures the liver glycase protein, and perhaps injures the endothelial cell. And since I have such a precious feeling about the endothelial cell, this is why I make that option, but I'm well aware that the smoothie is working beautifully for patients who have lupus that Brooke Golden is working for, and I congratulate her on her achievement.
Thanks for that, Dr. Esselstyn. And up next, we have somebody named Ben. Welcome, Ben.
Hi, hello. Hello, doctor. As a follow-up to yesterday panel, I would like to ask your opinion about omega-3 deficiency. So I have a serious deficiency of omega-3, and although I eat grind flaxseed and daily 4 tablespoons, and I would like to ask you, I know that you recommend to avoid oils. How would you think about fix or increase the omega-3 without oils?
Omega-3 algae. Omega-3 algae plus chia seeds or plus flaxseed meal and green leafy vegetables 6 times a day.
Don't beat around the bush. Tell us how you really feel. Up next, we have Randy. Welcome, Randy.
Hi, from Ohio.
Good.
Thank you. Great talk. Question about ED. My husband had a heart, irregular heart. He went in, they diagnosed it as a left branch block, and then went in to see if he needed any stents, but they said no, everything was clear, needed no stents. We've been plant-based for over 2 years. So just any other suggestions on that?
Well, I think I'd see a urologist who perhaps deals with ED on a regular basis. You need a nervous system, you need to have hormones, and you need to have an adequate blood supply, and they can run through all of those and be sure that there's that everything does not show any deficits, and hopefully they can turn that around.
Thanks very much, Doctor. And up next, we have Alejandro. Welcome.
Hi, thank you, Dr. Esselstyn, for your time and for all the work you're doing for humanity. I've been studying nutrition for about 9 years, or almost 9 years. And my question to you is, for somebody that's wanting to start a coaching business in the field of health and nutrition, what advice do you have?
For somebody who's going to start a business in health and nutrition, am I?
Yeah, that's right.
Am I hearing it? Yeah, I would. Well, put yourself in develop a relationship with somebody who's already been successful at that, and they would, because that's, I'm sure, can be a fairly competitive business, and there's going to be all those nuances and hoops to go through that somebody else has already been through them, and if they're willing to develop a relationship with somebody who has this going successfully, in all likelihood, they'll want to help you, and they would be in my mind, they would be the people who would have the greatest innate knowledge about how to do this.
Thanks very much, Doctor. And now, forgive me, I'm not sure if it's Stefan or Stephanie. Welcome.
Hi, Doctor. How are you? Can you hear me?
Yes.
Oh, great. Thank you very much for the talk. It was really insightful and knowledgeable. Thank you for that. I guess my question is, what's a good test for someone in their mid-40s who's completely plant-based, but still experiencing shortness of breath and fatigue for their heart health? And then when you are talking about eating the greens, can it be steamed and can you have a lemon with it, or does it have to be raw when you eat the greens?
No, steamed is fine.
Okay.
And what was the other part of the question?
Yeah, sorry, just a good test for heart health for someone who's completely plant-based in the mid-40s.
Yeah, well, there's a number. Probably the easiest and straightforward would be to get a calcium score. Calcium score was just a sort of a CT X-ray of the chest, and if you've got some blockages in your arteries that have calcified, that'll show up, and then you can be motivated to make some significant lifestyle changes.
Thanks, Dr. Esselstyn. And coming up now is George. Welcome, George.
Thank you, Dr. Esselstyn. Can you kindly comment on whether the caffeine in 1 or 2 grams of matcha green tea would damage our endothelial cells?
I don't have information that green or black tea can injure endothelial cells. There are 2 studies showing that the coffee with caffeine will injure endothelial production of nitric oxide. The Italian study is the one I usually refer to, and that's where they took a group of healthy young subjects, divided them in half. One half drank coffee that was decaf, the other drank coffee that was caffeinated. Then they would do the brachial artery tourniquet test after they drank, and then they would switch groups. So the group that previously was having coffee with caffeine was now decaf. It was always the group that has coffee with caffeine that injured endothelial cells.
Got it. Thank you very much for that. And up next we have, I'm going to ask Ivan to unmute. Let's see if that, there we go. Hi, Ivan.
Hello, can you hear me?
Yes.
Thank you, Dr. Esselstyn. I have a question for you about the use of Viagra, sildenafil for people with blood vessels, damaged blood vessels. Have you used this medicine? Are there secondary effects?
Well, it's an interesting question, and I think things like Cialis and Viagra have helped some patients who are having difficulty. And I really pretty much like to defer all that to a urologist who has a special interest, because I think it's important to look at all the aspects of what causes erectile dysfunction and have those sort of safely monitored by somebody who has a special interest in that. And there are urologists who do that.
Thanks very much for that. And up next we have Steve. Welcome, Steve.
Hello.
Hi, we hear you. Thank you.
You can hear me, yes?
Mm-hmm.
Yes, Dr. Esselstyn, I just want to ask, the CT scans that you do, wouldn't there be a lot of radiation going into the body while the process is going on?
Well, yeah, it depends what but just for a CT scan for the chest X-ray to identify.
Yes, that's right.
To identify whether or not you have coronary artery disease, I really think that it's modest enough radiation there that with the information that is gained is certainly appropriate. I wouldn't feel you had to do this on a regular basis, though, but because once people understand that they have got documentation, this is even if they don't have any symptoms, that they've got documentation of early coronary artery disease because of these calcifications that have been identified, that often is an inspirational message to them that makes them appreciate and understand that, by golly, this is serious. I better get down to work and go to work on this. Now, if you do on a regular basis, you do a nuclear stress test. I think there are many who would agree that you don't want to do too many of those. Then the radiation does get high.
Thanks very much for that, Doctor. And up next, we have someone with the initials VT. We've just asked you to unmute if you can. We'll try that one more time. VT. Something's not quite working there, so we're going to go on to Steve. Hi, Steve. Welcome. Or Stephen.
Thanks again to the moderator. I appreciate it. I met you once, Dr. Esselstyn. It was just a great honor. You were at Rochester speaking. I've been whole foods plant-based for over a decade. You know, I read the China study, I read your book, and it's just fantastic what you've done for health in this country. My blood pressure's good. My weight is close to college weight. Everything's good. My cholesterol bounces between 154 and 180. I'm whole foods, plant-based, no added oil, little salt, little sugar, not much. You got any opinions on that?
Well, I think you're gonna be fine. You know that the thing that's interesting is that if let's suppose that I get 1,000 patients who would totally follow our program, 100%. There would be some who would have a total cholesterol of 102. Some would be 120, 140, 160, 180, 200, 220. Everybody has a different thermostat on their liver. We all need cholesterol. Every single cell membrane in our body is made up of cholesterol in the wall. So it's the foundation for our sex hormones. It's a foundation for vitamin D. So, and I just know now that even though somebody has a cholesterol in that range, if providing they are eating 100% plant-based, they are building an endothelial fortress. Even if you've got a few extra molecules of cholesterol, you cannot injure your endothelium because you're making it so healthy by how you're eating. Now, the other way you can kind of confirm what I've said is whether all your inflammation is gone or under control. You can ask your cardiologist to get a blood test for cardiac inflammation, things like HSCRP and myeloperoxidase. You know.
Thanks very much, Dr. Esselstyn. And folks, I'm sorry we are up against the clock. It's time for our next lecture. So we're going to bring this Q&A to a close. I'm sorry we couldn't get to every question, but keep raising your hands for future lecturers. And in the meantime, Dr. Esselstyn, wow, thank you. Thank you for coming back again this year. Thank you for everything you shared last night. And now here, the presentation was thorough as always, and just life-changing for so many. So we just want to thank you on behalf of The Real Truth About Health. And frankly, I know I'm not the only one that wants to thank you. So we're going to have our tech team unmute our entire audience. What does everybody want to say to Dr. Caldwell Esselstyn?
For sure.
Thank you.
Thank you.